There you go.
That is awesome. That's amazing.
Yeah. So that came as a joke because...
welcome. Today we have with us Janessa Campbell. She's a musical therapist for Applegate Home Care and Hospice. And today we're just going to talk about music therapy, what it is, who it's for, and just learn all about it. So thanks for being with us.
Yeah.
Perfect. So I'll just get right into the first question, which is, can you briefly explain what music therapy is and how it helps patients in hospice or home care?
Yeah. So in short, music therapy is using music with an emphasis on creating rather than listening. It's using it to support physical, psychological, emotional, and social well-being. Music therapy can help to strengthen relationships, recall memories, express difficult emotions, and even improve communication, speech, and language. So I just want to give a brief little explanation of how you become a music therapist, because a lot of people ask that. So it's a degree. I have a bachelor's degree in music therapy. There are master's and doctorate degrees as well. Part of my bachelor's training was a 6-month clinical internship. I just happened to do mine with a hospice in Cleveland, but it's working under a certified supervisor. And then after you graduate, pass all the requirements, you pass the National Board Certification exam.
Okay.
And keep your certification up by doing 100 continuing ed credits every 5 years. So it's not just I like music, I'll go be a music therapist. There's credentialing. And in fact, in Utah, in order to be a music therapist, you have to get licensed through DOPL, Division of Professional Licensing, and show that you have your board certification current.
Dang, that's crazy. So there's a lot of hoops you have to jump through to be able to qualify.
You know, people are surprised because they think music therapy, I like music, I'll go be a music therapist. And I'm like, that's great, but there's more to it. You know, it's like training to be, physical therapist, nurse, occupational therapist, any of those.
Yeah.
So.
That's awesome. That's perfect.
Yeah.
And then what inspired you to become a music therapist?
A love of music, even though I didn't always love it as a kid, but a love of music and a love of helping people. As a high school junior, I got to go to the University of Washington. I lived in the Seattle area with my neighbor, and they had a daughter who was born with some physical and developmental disabilities, and they were going to a presentation on music therapy. So they said, hey, do you want to come with me? And I said, yeah.
No way.
So, yeah, I came home from that and I told my parents that's what I'm going to do. But I didn't know I was going to go into hospice with it.
Yeah, so what guided that path?
So as I was doing my schooling, we did practicum work, and some of my practicum work with hospice patients, some personal family involvement with hospice, and then when I applied for internship spots, I don't know exactly why I went to the one I went to, but I loved it, and here I am.
That's cool. That's awesome.
Yeah.
And how long have you been with Applegate?
Oh gosh.
It's been a minute.
10 to 15 years.
Holy cow.
Yeah, I can't remember.
Next question is, how do you tailor music therapy sessions to individual patients?
Yeah, so individual is the key word. When I go into each new setting, I love to hear people's stories. I love to get to know them. So I work to see and understand people for who they are. Whether that's, a fully functioning person out on the street, whether that's a comatose hospice patient, obviously, depending on their ability to communicate, I'll get so much information from them and so much from others if they're around. But I try to get a lot through observation as well. I like to find out a little about them either through questions or watching. And I aim to find out preferred songs, genres of music, musical experience or memories. And I always tell people, my promise is always, I know a lot of music and I know a lot of the basic music that people in the hospice realm are going to connect with. But if they have a favorite song, I promise to do my best to go learn it. And I've learned
That's
some
awesome.
really cool songs that way. So, but when I learn this stuff about them, then I base the music that's used upon that and what I'm actively working with them on. If it's, we'll talk about it more and further on, but you know, pain management versus anxiety versus connecting with family and others.
Totally.
And so that's, and it can change on a dime with their situation.
Yeah, totally.
So,
That makes total sense. And then, what kinds of emotional or physical benefits have you seen from musical therapy? I'm actually really excited for this one.
yeah, I could go on forever about this because there are so many benefits that come from music therapy. Music is one of the only activities that stimulates and uses the entire brain. So specifically in hospice work, I've seen patients recall memories that they haven't talked about or remembered for years. I've seen them be able to verbalize when they couldn't before. I've seen it calm anxiety, decrease pain, and bring families and caregivers together to create memories for as the loved one passes.
That's awesome.
So,
That's way
yeah.
cool. Sweet. And then, what types of instruments? Obviously, you have the guitar here. What types of instruments do you typically use in your sessions?
Guitar and voice are the two main ones because they're most transportable. I've also used the piano, the ukulele, the viola, some hand percussion instruments. And because kind of a joke in our hospice team, I have a nose flute.
No way.
Yeah,
Let's see it.
it's right here.
How do you play it?
I can't do it if I laugh. There you go.
That is awesome. That's amazing.
Yeah. So that came as a joke because a patient that had been on services, then, you know, he improved, so he was off services, and he came back on. And when the nurse saw him, Nicole, you'll have to help me remember, but he was like, yeah, I want that lady who plays the harp to come, that lady that plays the flute. And so we were talking about this because I don't play the harp or the flute. And so somehow we got to nose flute, and I was like, well, I've heard of a nose flute, so I'm going to find one.
I've never heard of it. That's awesome.
Yeah, now you have.
That's way cool. Now I've seen one played. That's
Yeah.
amazing. What a day. Perfect.
This is going to be the most unique interview.
This is hilarious. Holy cow. That's not good because my face gets red when I laugh sometimes. How does music impact patients with dementia or Alzheimer's?
So yeah, we work with a lot of this in hospice. Music therapy can improve mood and reduce agitation or anxiety. I've gone into situations where I've walked in and people are like, good luck, this person is on one today, and we've been able to get them to a much calmer state. It can work as a cue to access and recall and verbalize memories. So that can also increase feelings of connection with loved ones and people around them. It can facilitate communication, even when someone has been limited in their verbal skills for years. Just a recent experience with a patient we had come on, I think she had a stroke and could only beep. Like you would talk, she could communicate with her family with her eyes indicating yes or no, but all that she would verbalize at the time was beep. And I actually saw her when the doctor and the nurse were there, and I started playing, and in that first session with her, she started singing some, and she's improved in some of the aspects of her condition such that she can talk pretty well now.
Wow.
It's not all due to music therapy, but
Yeah.
that helps. So communication, it can decrease the sense of isolation through the social engagement. So because the music therapy can affect the brain so well, it can stimulate the brain's ability to change and adapt and increase the release of dopamine for people, which helps in cognitive and emotional functioning.
Totally.
So it can also help to support relationships between patient and caregiver or family to create a more supportive environment for those individuals.
That's great. That's perfect. And then can you share a meaningful experience? You've already actually shared a great one.
Yeah.
And that you've had with a patient through music therapy.
Yeah, so there was the one I just mentioned, but then a couple others that came to mind. There was one woman that we had on services for years. And I was in there with her one day in the advanced stages of dementia, and most of her speech was nonsensical, but as I was working with her one day, she lived in the home, in her daughter's home. And all of a sudden, through some of the music therapy, she started talking for a few moments clearly about her husband, who had passed away several years before. And the daughter just came around. She wasn't in the room, but she was in the next room, and she came around totally in tears and said, "I haven't heard my mom talk about my dad for years." So it brought up that memory. I have been at one bedside as the patient passed. He had his wife and a whole multitude of kids that they had surrounded him, and that was a most amazing experience. I'm not often there at the moment of passing, but just watching the family and the support that the music therapy was able to bring in, and the gentleness at which this man took his last few breaths. And then, as he took his last breath, it was almost like this pause in the room, and I was able to pause the music with that. And then as the family started to move forward, I was able to bring the music in to support that transition for them.
Totally.
So.
Wow, that was amazing.
Yeah.
And then the last question we have here is, what would you say to someone who's unsure if music therapy is right for their loved one?
Yeah. So this is a great question, because a lot of times I get people saying, music therapy, what's that? Or my loved one isn't musical, so why would I want music therapy? Whether a person has actively played music in their life or not, we're musical beings. We come into this life with a heartbeat, and we leave this life with an absence of a heartbeat. And that's rhythm. That's the foundation of music. So we can all interact with and through music in many ways that we might not even know. As I mentioned before, music therapy is one of the only activities that can stimulate the entire brain. So that's what I'd say in general, but specifically with Applegate. So music therapy is a service that Applegate offers, and not all hospice companies offer music therapy, but it comes at no cost to the patient and family. So my comment to them would be, give it a try and see if it benefits them. There have been several families who are hesitant at first, not knowing what it was, that then once they engage with it, they're like, wow. In fact, the woman who beat, they told me that at first they were unsure of if that would help them and how it would help. But, a few months into it, they always look forward to it.
That's way cool.
So, yeah.
Well, sweet. Thanks, Janessa. Thanks for your time.
Absolutely.
Perfect.
Thank you.